Good afternoon. In addition to the programs that Dr. Staboinka and Dr. Kim described, I want to make sure we highlighted a few others. RUHS has been named an accredited cancer program by the Commission on Cancer. This honor is only given to 30% of hospitals. It means that when our patients receive cancer care at RUHS, they are receiving the highest level of treatment available without having to travel to Orange County, LA County, or further for that matter. Most cancer care at RUHS is available on-site. We are aiming to be a one-stop destination where we don't have to send any patient outside of our boundaries to receive their care. We now offer super specialized complex surgeries, performing over 500 surgeries and operations a year related to cancer. It's important to note that we are very focused on prevention as well. Recent improvements include same-day appointments, so we're promoting mammography on same days when someone with their gynecological exam. We also, as talked about in our April governing board meeting, have our MBI machine. So it's our molecular breast imaging machine for which we are using and seeing those patients and diagnosing cancer earlier. But the Cancer Accreditation isn't the only recognition that we're getting. I'm excited and proud to announce that our community health centers, your community health centers, have actually received 4 badges from our federal agency, HRSA. This is actually, as described by Dr. Leung and Dr. Sang, the Academy Award for health centers across the United States. One of the badges is for being in our nation's top 20% of healthcare centers, providing high quality patient care in areas such as behavioral health, heart health, and diabetes health. The second badge is for increasing the number of patients who receive service by 5%. Our third badge is for demonstrating improvements in chronic disease and birth outcomes for at least one racial or ethnic group, or meeting established benchmarks for all racial and ethnic groups. And the final badge is for optimizing healthcare information technology services by adopting an electronic health record, as known as EPIC, offering telehealth services and other metrics. These achievements all show the commitment we're making to our patients, and the distinction is clear. RUHS is the largest health center network based in the Inland Empire by patient volume to earn all quality related badges in this region. For all of the accolades and award, RUHS really understands that it's about the patient experience. So I'd like to share with you and close with a video featuring the story of Sarah Zamora, whose story is proof of what the strategy to integrate care and to keep the patient at the center of all we do, to keep our patients safe. We know that our patients don't belong in the emergency room. They don't belong in the hospital. And our goal is to ensure that we're providing comprehensive care, integrated care, to get our patients back home. Thank you.
Addiction nearly took everything from Sarah Zamora.
My children got taken away, all 7 of them. I lost my home, I lost my family, I lost my sanity, and I was losing my health.
A battle with opioids sent this Riverside County resident on a downward spiral. Child Protective Services intervened, and at rock bottom, homeless and living out of her truck, Sarah visited Riverside University Health System's Corona Community Health Center. Its integrated care model provides over a dozen services, from primary care and pharmacy to dentistry, radiology, and orthopedics, even specialties.
We're just really striving to be a one-stop shop for your patients so that we don't have to go to multiple locations to get these services. We do have our express care, which that means you don't need an appointment to come see us here. We do have a nutritionist on staff, a dietitian. We do have our program called Enhanced Care Management, which is our case management program, behavioral health.
It was that final resource that helped spark Sarah's journey to recovery.
After I had found the clinic, they soon started, giving me hope. It was like, I'm a believer. It was like an angel waiting for me at the door.
That angel was Rosie Flores Foland. Her official title is Certified Substance Abuse Counselor, and her chief concern was addressing some of Sarah's most immediate needs.
She asked me, where do you live? And I told her in my truck. And out of my truck, and she goes, yeah, but where? I'm like, well, anywhere where I feel safe. And I remember she just got up and walked out of her office, and she went to go talk to the peer specialist. Brought her in, introduced her to me, which is Amy Black.
I remember when her counselor, Rosie, was working with her and did her intake and everything like that. And she comes out and she comes grab me and she goes, "You need to get in here." She's like, "I got this girl in here, man. She's been homeless. She needs food. She needs shelter. We got to do something." And I'm like, "Let's go," because that's what we do.
Right away, they found me a safe place to be in. And soon after that, that's when my journey began. I went to my meetings at the clinic. I went to whatever was suggested to me.
Sarah continued on the path, regaining custody of her children and moving into a home with her family.
Addiction is a process, and the process is an up and down roller coaster, and she could understand that, and she could see it for herself, and getting on meds and getting stable on meds and doing all that stuff that she needed to do for herself, not just taking care of her substance use but also taking care of her mental health, that was the key.
RUHS helped Sarah take the first steps of her recovery, and now, with its integrated design, the Corona CHC will be there to provide continuing care and support.
With integrating everything, it just makes it easier for the patient, so that way they know they can receive all these different services at one clinic where they become familiarized with the staff, and with the staff, we all work together to ensure that the patient receives that care that they're looking for.